Over the past 4 years, patients in British Columbia have been denied access to some critical medications that they need when compared with patients in other provinces. As patient advocates, we looked at currently available public data on healthcare expenditures in Canada and identified a major problem: the chronic underfunding of BC pharmacare. British Columbia's per capita spending on healthcare is nearly identical to the Canadian average. However, during the past 5 years, BC's public healthcare spending growth rate ranked 4th in Canada, which is significantly higher than the Canadian average. In the last 10 years, hospitals, physicians, and public health accounted for 93% of the growth in the healthcare budget. Public expenditures on drugs has not kept up compared with other healthcare components, such as public health, hospitals, administration, physicians, and other healthcare professionals. BC public expenditure on drugs represents only 6% of the total BC public healthcare budget. Breaking down that 6% of the BC pharmacare budget, we see that generic drugs account for 25%, pharmacy fees, including dispensing fees and markups on drugs, is 21%, innovative brand drugs is 42%, and additional costs at 12%. BC public health expenditure for pharmaceuticals on a per capita basis is the lowest in Canada by a substantial margin, resulting in many drugs unavailable for reimbursement by pharmacare. In the short term, it is very important to adequately fund pharmacare so patients get the medications they need, which in turn will reduce healthcare costs in other parts of the BC healthcare system over the long term. BC pharmacare includes significantly fewer drugs than all other provinces on its public drug formulary. These are vital medications that have gone through all of the Canadian approval processes, and the majority are covered for patients in other parts of Canada. Publicly available evidence clearly shows that BC is underfunding its pharmacare program compared with all other provinces. Pharmacare should provide patients with a variety of medications, from those that improve quality of life to those that are life-saving. Other parts of Canada recognize this. By not providing coverage for these essential medicines, including those for idiopathic pulmonary fibrosis, BC pharmacare is increasing costs in hospital and physician services.